March is Colon Cancer Awareness Month, and with recent changes, it might be time for you to get tested.
So for today's In Good Health, Whitney Amann has what doctors recommend and how McLaren Northern Michigan is making that process just a little easier.
It's the third most common cancer in men and women, and the third leading cause of cancer-related deaths.
On average, there's about 150,000 people in the U.S. that are diagnosed with colon cancer each year, 50,000 deaths due to colon cancer each year.
But colon cancer is curable.
It has about an 80% cure rate at 5 years. Better if caught early, but if it's already advanced to the point where it's going to other organs, then the cure rate is lower.
And there are things you can do to help prevent that diagnosis.
We know that smoking increases the risk. Overweight and obesity increases risk, heavy alcohol use increases risk, and sedentary lifestyle.
Along with those lifestyle changes, getting tested at the right age is key.
The age now is 45 for all adults. It used to be 50 for adults and 45 years old for African Americans, but now it's 45 for all adults.
Your doctor might also recommend getting tested sooner, depending on your family history.
If you have a history of colon cancer in a first-degree family member, so mom, dad, brothers, sisters, then you should be screened early for colon cancer.
Elizabeth Resignal decided to get her first colonoscopy after her annual physical.
You know, the older I get, the more people I know, and the more people I know that have had colon cancer, or, a friend of a friend that has it. And sometimes it's not the best news, and it could have been prevented.
When we do colonoscopies, we mostly are looking for polyps so that we can remove them, but also we're looking for diverticulosis, abnormal inflamed tissue like colitis, anything that does not look like normal healthy tissue.
I was glad to get good test results and kind of ease the burden of having that on my mind. Is something wrong? Is there something, more terrible that could be wrong with me? And it just kind of was nice to know that everything's okay.
There are options when it comes to getting tested.
The gold standard is a colonoscopy, but there are other ways like CT colonography and stool testing that can be performed.
For Colon Cancer Awareness Month, McLaren Northern Michigan is giving out free at-home tests.
The test that we are offering actually tests for blood in the stool, and that is a really early sign of polyps that could be growing within the intestinal walls and that in the bowel. And that is not any indicator of cancer, but it is something that's concerning, and then it could be evaluated further to check out and see what's going on.
This month, serving as a reminder, any test is better than no test.
The older I get, the more I realize I'm not invincible, and neither is anyone else. So why not get a screening that could possibly save your life?
For In Good Health, I'm Whitney Amann.
And for more health tips and where you can find your free test near you, just head over to the In Good Health tab on 910news.com.